The scan came back at 11:47 p.m., and the radiologist's voice on the phone did something I hadn't heard from a colleague in 6 years. It shook. "There's something in his chest cavity," he said. "Metallic. Regular shape. It's not shrapnel." I looked at the image myself 30 seconds later, and every single thing I'd spent 6 years trying to forget came rushing back into my hands at once. My name is Vivian. That night, an ordinary trauma patient turned into the most dangerous thing inside our entire hospital, and only one person on that floor had any idea what to actually do about it. I've worked trauma nursing at Ironwood Medical Center for 6 years, the kind of job where every night shift is its own small, unpredictable war. Car wrecks, overdoses, the occasional gunshot wound that reminds everyone in the building briefly how thin the walls are between an ordinary Tuesday and someone's worst night. My co-workers think I'm just unusually steady under pressure. A few of them joke that nothing rattles me, which is truer than they realize, and for reasons none of them know anything about. There was a night, maybe 8 months ago, when a multi-car pile-up brought us 5 critical patients at once, and one of my newer co-workers, a resident named Dr. Patel, froze completely at the sight of a compound fracture bad enough to make an experienced tech step back. I didn't freeze. I didn't even feel the specific jolt of adrenaline everyone else in that trauma bay was visibly fighting through. I just moved, calm and steady, the way I always do, and got him stable enough to reach surgery. Dr. Patel asked me afterward how I stayed so level. I told him, "You get used to it." That wasn't really true. The truth was considerably more specific than used to it. 6 years ago, I spent 4 years doing explosive ordnance disposal, the actual job, not the movie version. Deployed twice, worked with a joint task force the 3rd time, spent more hours than I'd like to count with my hands a few inches from something built specifically to end my life if I made one wrong move. I don't talk about it. My file says military logistics support, which is vague enough to survive most questions, and specific enough that nobody's ever pushed further. I left that work after an incident I still don't discuss with anyone, not even the therapist I saw for exactly 6 sessions before deciding I'd rather carry it quietly than keep reliving it out loud once a week. I became a trauma nurse because it let me keep working with my hands in situations most people can't stomach, without anything in the room being built to kill me on purpose. I thought that distinction was going to hold indefinitely. It held for 6 years, right up until a Tuesday night in October, when an ambulance call came in that sounded, at first, like any other industrial accident. "Ironwood, this is Rescue 9, inbound with 1 patient from a warehouse explosion off Route 9. Male, mid-30s, blast trauma, multiple lacerations, possible internal injuries. ETA 6 minutes. Warehouse explosions aren't common, but they're not unheard of either. A gas line, faulty equipment, a spark somewhere it shouldn't have been. I had Trauma Bay 3 prepped and waiting when the doors opened and paramedics wheeled in a man named Wes, conscious, disoriented, peppered with debris wounds and burns along one side of his body. Dr. Alvarez, the attending that night, moved fast and competent, the way she always does, stabilizing airway, controlling the visible bleeding, calling for imaging to check for internal damage the naked eye couldn't catch. Standard trauma protocol. Nothing about the first 20 minutes suggested anything except a genuinely unlucky night for one warehouse employee. I worked alongside her, cataloguing the wound pattern out of pure habit. Entry points, debris distribution, burn severity. The same kind of assessment I used to do for entirely different reasons, in an entirely different life. Most of it read exactly like an industrial accident should. Most of it. What didn't quite fit was the specific spacing of 2 of the deeper lacerations along his lower ribs, closer together and more regular than the chaotic scatter you'd expect from an actual explosion's shrapnel field. I noted it, filed it away, told myself I was overthinking a pattern that probably meant nothing. Wes kept saying one thing, over and over in the brief moments he was lucid enough to speak. "Wasn't supposed to be there," he mumbled. "Wasn't supposed to see it." Dr. Alvarez didn't pay it much attention. People say strange things in shock. I filed that away too, the specific corner of my brain that never fully turned off, still quietly cataloguing details out of habit. 6 years of civilian life notwithstanding. I found a moment, 20 minutes later, to sit with him briefly while Dr. Alvarez reviewed his early labs. His eyes were half open, unfocused, the particular haze of someone riding the edge between shock and sedation. "Wes," I said, keeping my voice low and steady. "You said you weren't supposed to see something. Can you tell me what you meant?" "Crate," he mumbled. "Open crate. Wasn't labelled right. Told Danny about it and then..." His eyes closed again before he finished the sentence, monitor beeping in a steady, undisturbed rhythm that gave no indication anything he'd just said mattered at all. I sat with that sentence longer than the moment probably called for. An open crate. Told someone. And then an explosion on the exact same night at the exact same warehouse. I've spent enough years around things that explode to know the specific shape of a coincidence that isn't actually one. I didn't say anything to Dr. Alvarez yet. I didn't have anything concrete enough to say. I went back to my other patients, checked vitals, charted medications, and told myself, the way I'd told myself 100 times in my old life, that instinct without evidence is just anxiety wearing a more flattering name. I was about to get considerably more evidence than I wanted. The radiologist called the floor directly instead of just uploading the images, which is unusual enough on its own that I picked up expecting a routine clarifying question. "I need Dr. Alvarez and whoever's charge nurse tonight," he said, voice tight in a way I hadn't heard from him before. "There's something in his lower chest cavity. Metallic. Regular geometric shape, not consistent with shrapnel or debris. I don't know what I'm looking at, and I don't like that I don't know." I pulled the images up myself before Dr. Alvarez even reached the workstation, and the second I saw the shape on the scan, 6 years of training I'd spent enormous effort trying to set down came rushing back into my body all at once. It was a submunition. A small, unexploded piece of ordnance, the kind that sometimes survives a larger blast intact instead of detonating, embedded in tissue exactly the way shrapnel would be. Except shrapnel doesn't have a fuse. "Dr. Alvarez," I said, and something in my own voice made her turn fully around. "I need you to listen to me very carefully, and I need you to trust me without asking why I know this yet." "What is it?" she said. "There's a live explosive device inside your patient's body," I said. "And every person on this floor needs to start moving like that sentence is completely true, because it is." She looked at the screen, then at me, then back at the screen, the specific double take of someone whose entire understanding of the night had just been rewritten in about 4 seconds. "You're certain?" she said. "I spent 4 years certain of exactly this kind of thing," I said. "Call it in. Now." The next 15 minutes were the kind of controlled chaos hospitals train for constantly and almost never actually need. Dr. Alvarez, to her enormous credit, didn't waste time doubting me twice. She activated the floor's emergency protocol, and within minutes, non-critical patients were being moved, families were being escorted toward the far end of the building, and a bomb squad had been notified and was already en route. The one person who did waste time was Gerald Finch, the overnight hospital administrator, who arrived at the nurses' station looking less concerned about a bomb than about what a partial building evacuation was going to cost in cancelled procedures and diverted ambulances. "You're telling me we're shutting down half the ER over an X-ray?" he said, arms crossed, looking at me like I was the actual problem, instead of the device I was describing. "I'm telling you there's an unexploded device inside a patient 40 feet from where you're standing," I said. "And every minute you spend arguing about liability is a minute the bomb squad isn't already here." "And you know this how exactly?" Finch pressed, apparently more interested in my credentials than in the actual emergency in front of him. "Because I used to do this for a living," I said, "and I would very much like to still be alive at the end of tonight's shift, which requires you to stop talking and start clearing this hallway." He didn't apologize. He also didn't argue any further, mostly because Dr. Alvarez gave him a look that ended the conversation more effectively than anything I could have said. The bomb squad's lead technician, once he arrived and reviewed the scan, gave me the news I'd been quietly dreading since the moment I saw the shape on that image. "Moving him is high risk," he said. "Body position, blast fragment orientation, it's all part of what's keeping this thing stable right now. We move him, we might be the reason it doesn't stay stable." He looked at me directly. "I understand you have relevant experience." "I do," I said. "More than I ever expected to need again." 4 years ago, on my second deployment, I lost a teammate named Ramirez to a device that looked, on paper, exactly like 100 others we'd handled safely. It was routine, or as routine as any of it ever got. A suspected IED cache in an abandoned structure, standard clearance procedure, the kind of job we'd done successfully more times than either of us bothered counting anymore. Ramirez took point that day because the rotation said it was his turn. Nothing more significant than that. Sometimes the difference between a safe device and a fatal one isn't skill. It's luck, and a fraction of a second, and a component nobody could have seen coming, buried inside a housing that looked, from every visible angle, completely standard. Ramirez did everything by the book. I was 15 feet back, exactly where protocol put me, close enough to hear it, and too far to do anything, except watch the exact moment procedure and chance stopped agreeing with each other. I flew home with him 3 weeks later. I stood at his funeral in a dress uniform that felt like it belonged to somebody else. And I told his mother, because she asked me directly, and I couldn't make myself lie to her face, that he hadn't felt anything, hadn't had time to be afraid. I don't actually know if that part was true. I've chosen to believe it anyway, the same way I imagine most of us choose the version of a story we can actually carry. I did the job anyway, for 2 more years after that, because the alternative was letting fear decide things for me, and I wasn't ready yet to let it. Then, in my 4th year, a second incident. Smaller, survived, but close enough that it finally convinced me I'd used up considerably more luck than any one person reasonably gets to spend in a single career. I don't tell people the specifics of that second one either. I don't need to relive it out loud to know exactly what it cost. or exactly why I chose a hospital hallway over a blast site for the rest of my working life. Standing in that hallway at Ironwood 6 years later, looking at a device inside a living man's body, I understood something with total clarity for the first time since I'd left that career behind. I hadn't actually stopped being the person who does this. I'd just stopped being asked to. The bomb squad technician was competent, clearly capable, and completely unfamiliar with this specific complication. A live device stabilized inside human tissue instead of sitting in open air where standard procedure actually applied. He needed hands with medical training and ordnance training both, in the same body, in the same room, in the next few minutes. There was exactly one person in that hospital who fit that description, and pretending otherwise for even a few more minutes was a luxury none of us actually had. "I'll go in," I told the technician. "Walk me through your equipment and I'll walk you through what his tissue is actually doing around it. We do this together or we don't do it in time." He studied me for a second, the particular assessment of someone deciding whether to trust a claim that sounded almost too convenient to be real. Then he nodded and handed me a vest, and 6 years of civilian distance folded itself away in about 4 seconds flat. The bomb squad cleared the immediate floor of everyone except essential personnel: myself, Dr. Alvarez, the technician, and one very steady anesthesiologist willing to stay. The device's position meant it needed to be approached the way you'd approach any unstable ordnance: slowly, deliberately, with absolute respect for how little margin for error existed. "I need total silence in this room," I said, pulling on the blast-resistant vest, hands already settling into the exact steady rhythm I hadn't used in 6 years, and apparently hadn't lost at all. "No sudden movements, no sudden sounds. If I ask for something, hand it to me slowly and tell me out loud exactly what you're handing me before it reaches my hand." Wes, sedated but not fully unconscious, mumbled something again. "Didn't mean to see it," he said, barely audible. "You're going to be okay," I told him, in the same voice I'd use on any frightened patient, even though every other part of me was operating at a level of focus I hadn't needed since a different life entirely. The first 10 minutes were entirely about understanding, not action, mapping exactly how the device sat relative to surrounding tissue, exactly what was holding it stable, exactly what any given millimetre of movement might disturb. The technician talked me through the housing's likely mechanism in a low, even voice. I talked him through what the body around it was doing, the specific give and pressure of tissue instead of soil or concrete, an environment he'd never once had to account for in years of doing this job. Every few minutes, the anesthesiologist quietly confirmed Wes's vitals were holding steady. Every few minutes, I felt my own pulse doing the specific, deliberate thing I'd trained it to do years ago. Slowing, not from calm exactly, but from focus so complete there wasn't room left over for anything as inefficient as panic. 10 minutes in, we hadn't moved anything yet. We'd only finished understanding what we were looking at. I remember thinking, distantly, that this was already longer than most of the actual diffusals I'd handled in my old life, and we hadn't even reached the difficult part yet. Dr. Alvarez's radio crackled softly against her hip, low enough not to disturb the room, but I caught the tension in her posture as she read the message on the screen instead of speaking it aloud. She caught my eye and mouthed 3 words: visitor, restricted floor. I couldn't leave, not with my hands exactly where they were, not with 11 more minutes of work still ahead of us. I gave her a single nod instead, the kind that meant, handle it, and went back to the millimetre of tissue in front of me, forcing my attention to split in a way I hadn't had to manage since a very different kind of multitasking, years ago, under considerably worse conditions than a quiet hospital room. Security's report came back through Dr. Alvarez a few minutes later, relayed to me in short, careful phrases, so as not to disrupt my concentration. A man in a visitor badge, claiming to be Wes's co-worker, standing just outside the restricted perimeter, watching the hallway with an intensity that didn't match ordinary concern for a friend recovering from an accident. "He's not looking at Wes's room," Dr. Alvarez murmured, watching a second camera feed on her phone while still monitoring the room. "He's looking at the equipment cart, the containment case." "Have security hold him at the perimeter," I said, without looking up. "Don't let him leave yet, but don't let him in either. I'll deal with him the second this is done, not 1 second before." Every part of me that used to do this job for a living understood exactly what that meant. Somebody out there already knew what was inside this hospital, and was considerably more interested in it than in the man it was currently trying to kill. The final phase was the part that actually mattered, the part where understanding finally had to become movement. I worked with a patience that has nothing to do with speed and everything to do with never once letting urgency turn into a mistake. Careful, deliberate, each motion confirmed twice before it happened once. The technician talked through each step before I made it. I confirmed tissue response before he moved anything mechanical. Between us, slowly, methodically, the device came free from its housing, stabilized, contained. The specific danger it represented shrinking with every controlled second that passed without incident. There's a particular silence that settles over a room during a moment like that. Not peaceful, not calm exactly, just complete. Every single person present holding their attention on one narrow point in space like nothing else in the building currently existed. It came free, intact, stable, into the containment case the squad had ready and waiting. I didn't feel triumphant. I felt, mostly, like someone who'd just remembered exactly how much weight this kind of silence actually carries, and how much I genuinely missed carrying it underneath 6 years of telling myself I hadn't. "Case secure," the technician said, voice unsteady with relief, in a way mine, for once, genuinely wasn't. "Patient stable, room clear." I peeled off my gloves, looked at Wes's steady, undisturbed vitals on the monitor, and finally allowed myself exactly 1 full breath before remembering there was still a man in the hallway who needed considerably more urgent attention than my own relief. I stepped out into the corridor to find him exactly where security had held him, arms crossed, doing his very best impression of a bored, patient visitor, though his eyes went straight to the containment case the moment it came through the doors behind me. "Just want to make sure my buddy's okay," he said, smiling in a way that didn't reach anywhere close to his eyes. "Terrible accident." "It wasn't an accident," I said, watching his expression carefully. "Was it?" Something in his face changed, fast. The specific look of a man recalculating whether the conversation he thought he was having had just become a very different one. "I don't know what you mean," he said. "I think you know exactly what I mean," I said. "And I think you're a lot more interested in what came out of that man's chest than in how he's doing." He didn't wait around to keep arguing. He turned fast, heading for the stairwell instead of the elevator, which told me everything about how much he didn't want security footage of his exit. I radioed the floor's security team while moving after him, keeping my distance, watching his hands, watching his pace. Every instinct from a different life sliding back into place with uncomfortable ease. "Stairwell B, moving fast. Possible connection to the warehouse incident," I said. "Do not let him leave the building." He hit the stairwell door and found it already blocked. Ironwood's security, alerted a full minute earlier, closing the gap faster than he'd planned for. He turned, cornered, and for a moment I watched him consider exactly how much trouble he was actually in. "Whatever you think you saw in there," I said, catching up, keeping my voice level, "the device already came out clean. Whatever you were hoping would happen tonight already didn't." Something in his shoulders dropped, the specific posture of a man realizing the plan he'd been running on had just ended considerably earlier than expected. He didn't run again. Security had him restrained within another 30 seconds, and for the first time in almost an hour, the hallway went genuinely, completely quiet. The police detective who arrived a little after 2 in the morning explained, over the next hour, exactly what the warehouse explosion had actually been. Wes worked loading crews for a shipping company that had, unbeknownst to most of its employees, been quietly moving stolen military ordnance through legitimate freight routes for the better part of a year. Wes had stumbled onto an open crate 2 nights earlier that he wasn't supposed to see, mentioned it to a co-worker named Danny, and the explosion that brought him to us hadn't been an accident at all. It had been an attempt to eliminate a witness and destroy the evidence in the same convenient act. The man in the stairwell was one of the people running that operation, sent to make sure the job had actually finished what it started. He hadn't expected the evidence to still be alive, on a hospital floor, with an unexploded piece of exactly what he was trying to hide still lodged in his chest. "You saved considerably more than one patient tonight," the detective told me, looking at the containment case being logged as evidence. "That device, and whatever's still sitting in that warehouse, is going to help us take apart an entire trafficking operation that's been running considerably longer than anyone realized." "I was mostly just doing my actual job," I said, which was true, in the sense that both of my jobs, old and new, had somehow ended up being exactly the same thing that night. Wes came out of observation 2 days later, stable, recovering, considerably more talkative once the sedation wore off completely. He found me during a shift change, still in a wheelchair, and thanked me in the specific, overwhelmed way people do when they've fully understood, only after the fact, how close they came to not being here at all. "I really didn't mean to see anything," he said. "Wrong place, wrong time, and I still don't fully understand why it had to go this far." "Some people would rather blow up a warehouse than let a witness talk," I said. "You didn't do anything wrong by seeing what you saw. You just happened to work for people who thought a life was a reasonable price for keeping a secret." "The nurses on the day shift told me what you actually are," he said, studying me carefully. "Bomb disposal. That true?" "It used to be," I said. "Apparently it still is, some nights." He didn't have much of a response for that, and I didn't especially need one. I checked his chart, told him his discharge was likely within the week, and went back to a shift that had, remarkably, mostly returned to ordinary by that point. Gerald Finch never did apologise for the argument in the hallway, though the hospital board's official commendation letter, 3 weeks later, used the word heroic enough times that I suspect he found it easier to just stop bringing it up entirely. Dr. Alvarez still looks at me sometimes like she's trying to reconcile the nurse she's worked beside for 6 years with the person who calmly held an unexploded device steady for nearly 20 minutes without her hands ever once shaking. I've stopped trying to give her a complete explanation. Some things are simpler to just let people wonder about. I visited Ramirez's mother the following month, for the first time in 3 years. I told her what happened, all of it, and she listened the way she always has, patient and steady, and told me she was glad the training her son helped me build was still saving people, even years later, in a building he never once set foot in. I still work the trauma floor at Ironwood. I still don't tell most people what I did before this. But I don't feel anymore like that old life and this one are two separate people wearing the same face. Some nights, apparently, they're exactly the same person, doing exactly the same job, just wearing different scrubs. If you've ever discovered you were more prepared for a crisis than anyone around you expected, tell me about it in the comments. I read every one. And if this story kept you on the edge of your seat, hit subscribe. It genuinely helps keep these stories coming. Thanks for watching. I'll see you in the next one.